the patina study, this was finally published in January of this year in the New England Journal. I think we were all waiting for that. This was a really important trial as it looked at this strategy of maintenance endocrine therapy and palbociclib in combination with HER2-directed therapy in patients that had developed a response or stable disease to induction treatment. And you see here in terms of key eligibility criteria, they must have completed induction chemo and not had evidence of progression of disease. Patients with a history of asymptomatic CNS Mets were eligible. And again, the objective here was to evaluate the addition of palbociclib to anti-HER2 and endocrine therapy for these triple-positive patients. The primary outcome was investigator-assessed PFS, and highlighted here for you in red is that one of the secondary outcomes was incidence of CNS Mets, and I'll show you some newer data that was presented at San Antonio in that regard. So I think all of us were really pleasantly surprised to see the median PFS being so high here with this combination, including palbociclib, 44.3 months. But I think what was also really interesting to see was how that control arm did, 29 months. Remember here, patients all got endocrine therapy, and we heard from Paolo earlier that 18 months in Cleopatra. Of course, a different population because we're looking at patients that had complete response or stable disease or partial response here, but I still think it does highlight the importance of endocrine therapy in the maintenance setting.